Well, as a business owner, I can tell you that healthcare costs were killing my law firm. We provide a full health insurance package to all of our employees. We let them with one provider. We were getting double-digit premium increases until Obamacare passed back in 2000. I guess it was 2009. And so, healthcare benefits are really they really affect a business's competitiveness and its bottom line. The biggest thing I think we can do in this state, the last unfinished piece of business, is we need to deal with the uninsured population. I think we can primarily deal with that by expanding Medicaid. And I know that's controversial, but all the studies have shown that that's a net benefit to taxpayers. It generates about $180 million of tax revenue for Virginia a year, because the federal government will start paying for about $180 million of things that Virginia taxpayers are currently paying for. And that frees up money for us to do other things. They also say it'll create about 30,000 jobs, 30,000 good paying jobs, which will have people paying Virginia taxes. But most importantly, I think it will give a lot of families certainty about their health care. Right now, a lot of people don't go to the doctor because they're not insured, and they end up going when they're really sick, and they end up not being able to pay. And at the end of the day, when somebody can't pay, the people end up paying is business. It's people who have private health insurance, because that's the only place the system can make it up. The system can't make up that expense with Medicaid. It can't make it up with Medicare. It can't make it up with other kinds of care the government provides. It can only make it up with private pay health insurance. And the best way to get those costs under control is to get everybody into the system, spread the risk out, and expand Medicaid. And so that's what I think is the number one thing we could do. It also, I think, will improve the health of our hospitals all around the state. Many hospitals around the state operate at a loss and have huge Medicaid populations. The number one hospital for Medicaid births in the Commonwealth of Virginia is Fairfax Hospital. Mount Vernon Hospital, Mount Vernon Nova Hospital in my seat, where I represent right now, about 2 miles from my house, has a huge amount of Medicaid patients that come through the emergency room, and actually uninsured patients that come through the emergency room. And if we're going to keep these hospitals viable, I think we have to look at expanding Medicaid, and we have to get it done very soon.